guys, my name is Amanda. I am a certified medical assistant. I have been for 5 years, and I just took my recertification test again, so good for another 5 years. But then I feel like I'm going to feel really old because it'll be 10 years. So the reason for these videos is to talk about the field realistically. A lot of the things that you see out there, if you Google medical assisting or you're looking into programs, there's not many resources other than seeing what schools offer, and there's a couple things that I feel like are kind of fake about the field. I know I've seen a couple videos where they're so fake that I don't know. It's not very good. I'm gonna tell you that. So I'm just trying to make a page on YouTube that's got a lot of good information for those of you that are looking to see if medical assisting is a good career for you. I also want to touch on things for people that are in medical assisting school at this time. I also want to just go over things that might be helpful for people that are already in the field, all you medical assistants out there. No matter if you're fresh to the field or if you've been in it for a while, I'm really hoping to touch on some of that stuff, namely like what I like to call it is medical assistant burnout. Different things that I think would help anybody that's going to be in the field or they already are. My big thing that I see right now that I really have a criticism about is that when you go online to look for stuff that pertains to medical assisting, you're either really going to find something that's from a school. So something that is promoting why you should go to medical assisting school. It's going to be very cheesy, and sometimes you don't know if they're actually telling the truth or not, is kind of the hard part. I know when I was looking for schools, they had recruiters, and they did not portray the medical assisting curriculum and the schooling correctly. I had done some research, which is very hard to find on YouTube, Google, all that. So those are usually the things that I find out there are from schools and them trying to sell you on the medical assistant field. Other things that I find are very cheesy videos. So the ones that have the 80s in the background, you know, they got the 80s music, and then it's like totally outdated ways to be in the medical field as a medical assistant, which they don't help very much because it has changed a lot. Hi, let me take your blood pressure. The meaning of these videos, really what I'm trying to go after is not just the technical part of medical assisting, but I really want to touch on stuff that's off the grid. So stuff you're not going to learn in school. You'll learn how to do techniques like your blood draws, your injections, clinical, and your administrative and general knowledge. You're going to learn that in school, hopefully. But I want to touch on some of the things that you don't learn. So I kind of call it off the grid. We're going to kind of deviate away from that a little bit, but we will also go over some of the things that you will learn in school as well. And hopefully I can help you guys a lot with this. I think that it's something that's very important, especially if you're looking for this to be your career. Well, obviously, I think that we should start from the beginning. So what is a medical assistant? What do we do? So a medical assistant, we have two sides. So we can either do administrative work or we can do clinical. Sometimes I do see that we do both. It kind of depends. So it depends on the practice mostly. Smaller clinics or independent clinics are probably going to have you do a little bit more work than if you work for a big company. In Minnesota, there are a lot of different big companies, so they probably have you doing a little bit less than what you'd be doing if you were with a smaller practice. I do work with a smaller practice, but I think that they disperse all of the responsibilities to different departments, which is good. So medical assistant, we're able to work anywhere in the clinic. On the administrative side, we can do scheduling, we can work the front desk, check insurance, medical records, schedule surgeries. We can even do medical billing and coding. So there are a lot of places that we can work on the administrative side of medical assisting, and there's a lot of different things that we can do in the clinic. So we're kind of the all-around worker. We do everything. The other side of our job, which is the most prevalent, is doing the clinical side of medical assisting. So what I mean by that is working in a lab. We can work in a lab. You can get certified. A lot of times with medical assistants, we can do anything that we're trained on doing. So as long as there's somebody credible that can teach us how to do something, we're allowed to do it. So what you will learn in school, you learn to do blood draws, phlebotomy, processing, specimen. Hopefully they teach you how to do that. Injections. So we'll do injections on patients. EKGs. There are some schools that offer limited scope x-ray. My school told me that I was going to be trained for limited scope x-ray, and I did not get trained for that. They had an x-ray program there, so you'd think that they had the equipment that was available to do that, but they did not have us do that course. So with the limited scope x-ray, if that's something that your school offers, but it's optional, I probably wouldn't do it. Like I said, this is coming from my point of view, but I usually tell people, I wouldn't take that test unless, because it comes with a test, you have to do the test to be certified to do the x-rays. I usually say not to go down that route unless you end up working at a clinic that will have you do limited scope x-rays. So we're talking private clinics, usually like an urgent care or primary care clinic. Other than that, you're not really going to be doing that. So those are kind of the expectations for medical assisting. I hope that when you went to school that they told you that. Like I said, there's sometimes that they'll give you false information because it's usually private schools that offer medical assisting. Sometimes that it's like a technical college. I went to a private school and they have recruiters and they will lead you falsely just so that they can get you into that program, and they'll say what they need to say just so that you become more interested in it. They will give you false information just to make you another person in the system so that they can get to their quota. We room patients, which with these old school cheesy videos, literally they're gonna say, oh, all we do is check blood pressure for patients, and we take their temperature and ask how they're doing today and why they're here. That's not all we do. So we do room patients though. So a lot of times, and it depends on where you work. A lot of times they'll ask, they'll have you do chief complaint. So why is the patient there? I work in OBGYN. So are they having abnormal bleeding? Do they have, if you work in a different field, if you work in urgent care, you're asking why that patient's there. It's obviously you'll get an idea from what the schedule says that they're there for. But you're really looking for their chief complaint. Maybe there's something that they didn't want to tell the front desk. We can also assist with minimally invasive procedures. So we would assist physician assistants, NPs, so nurse practitioners, and physicians with certain types of small procedures that would be done in the clinic. So maybe that's taking assist out of somebody's back or something like that, like those gross videos that you see online, like the pimple popper gal. So we can help with that. We do sterile procedures too. So since I work in OBGYN, like I said, what we do hysteroscopy. So that's where we're looking inside the uterus and we're seeing if there's any polyps. Maybe we're doing a procedure in there. We tend to help with that. So we're kind of the sterile, helping the doctor do what they need to do. Clean up and set up are the things that we do also. So you'll learn to set up a sterile tray. I'm not exactly sure. In Minnesota, they don't allow us to go to the hospital to help in the OR. Maybe in other states they do, but I know in Minnesota that they don't. Well, guys, I think I'm gonna call it quits for this one. So I think I threw a lot of information at you, but that's pretty much the basics of medical assisting. I'm planning on making a video real soon, so maybe even today. We'll see. I just need a little bit more coffee, I think, and then I'll be good to go, because medical assistants, we need lots of coffee, and I think I'm on my third one today. So, I mean, cheers to that. So, third coffee of the day already. Cheers to all of you medical assistants out there, people looking into it, and all you students. Hopefully, I've helped you a little bit. That's really what I'm looking to do. So, let's do it up. Thanks for watching.